खुश रहिए आप लोग। I myself, Jeevan Pratishtha Rajvanshi from the Department of Faculty of Physiotherapy and Diagnostic. I am Assistant Professor in Optometry discipline. I am working in Jyoti Vidyapeeth Women's University, which is the first state women's university in Rajasthan. Today I will be discussing the leftover topic of orbit, in which I will be discussing the structures of the orbits and accessory structures of the orbits. Okay, so I will start by orbital margins. What are orbital margins? Orbital means orbit and margins means the edges. Margins. Okay. Then margins: superior margin, lateral, medial and inferior. Applied anatomy: superior is by supraorbital notch side of the nerve block. Lateral is by frontozygomatic suture prone for separation following blood trauma. Inferior at the junction of lateral 2/3 and medial 1/3, just within the rim. Small depression, origin of inferior oblique prone for tooth fracture and diplopia. Okay, now what is apex of the orbit? Orbit canal and suborbital fissure. Optic canal. It transmits the optic nerve and ophthalmic artery. Average length is 6 to 11 mm. It connects the orbit to the medial cranial fossa. In adult, its dimensions are achieved by 4 to 5 years of age. Optic nerve glioma, meningioma may lead to unilateral enlargement of optic canal. Okay. Now, what is superior orbital fissure? Superior orbital fissure, it is a comma-shaped aperture in the orbital cavity. It is bounded by greater and lesser wing of sphenoid. It is situated lateral to optic canal. It is divided into upper, medial and lower parts of common tendinous ring. Applied anatomy: Toulouse-Hunt syndrome and superior orbital syndrome. Inflammation of the superior orbital fissure and apex may result in multitude of signs, including ophthalmoplegia and venous outflow obstruction. Superior orbital syndrome: fracture at superior orbital fissure, involvement of cranial nerves, diplopia, ophthalmoplegia, exophthalmosis. Then connective tissue system, that is Tennant's capsule, orbital septal system and periorbita. Okay, then periorbita. What is periorbita? It is a loose adherent to the bones, sensory innervation by branches of fifth nerve. And then the orbital septal system includes the connective tissue septa, which are suspended from the periorbita to form a complex radial and circumferential interconnecting slings. These septa surround extraocular muscles, optic nerve, neurovascular elements and the fat lobules. Tennant's capsule, also known as fascia bulbi or bulbar sheet, dense, elastic and vascular connective tissues that surrounds the surrounds the globe, begins anteriorly at the prelimbal sclera, extends around the globe to the optic nerve and fuses with the dural sheet and the sclera. Separated from the sclera by periscleral lymph space, which is in continuation with subdural and supraarachnoid spaces. What are the contents of orbit? Eyeball, muscles and nerves. Which muscles? 4 rectiles, 2 obliques, LPS and molar muscles. And nerves, sensory branch of 5th nerve, sensory motor is 3rd, 6th and 4th nerve. Autonomic is nerve to the lacrimal gland and ciliary ganglion. Then vessels are also included in these. These are arteries and veins. Arteries, internal carotid system, branch of ophthalmic artery. External carotid system, a branch of internal maxillary artery. Venous, superior ophthalmic vein and inferior ophthalmic vein. Lymphatics, none. Lacrimal gland, lacrimal sac. Orbital fat, reticular tissue, orbital fascia. Surgical spaces of the orbit. Superior steal space, subcutaneous space, peripheral orbital space and its content, central space and its content, applied anatomy. So what are these? These are superior steal space is the potential space between the periorbita and the orbital bones. Subtenuous space is the potential space around the eyeball between the tenons and the sclera. Anterior and posterior subtendinous injections are given. Then peripheral orbital space is bounded by peripheral by preorbiter. Posteriorly it merge with the central space. Then what are the changes in the orbit with age? Infantile orbit are more divergent than those in the adult, and roof much larger than floor in infancy. Optic canal has no length at birth, a foramen at 1 year of age, and periorbita much thicker and stronger at birth than in adults. Then senile changes, largely due absorption of bones. Walls show thinning and fissures are widens. Thus, elderly skulls holes sometimes occur in the roof of the orbit, the periorbita being in direct contact with diameter. These all are the changes in the orbit, and these changes are in from birth to adultation. These are all changes. Have you understood about the medial walls of the orbit and its bones and its foramens, fossa and sinuses, and about the frontal sinus and about the zygomatic bone, sphenoid bone and all this, left lacrimal bone and all this. These all are, and the apparatus, landmarks for DSR and these all. Now, one more thing I would like to discuss is the floor. Floor formed by maxillary bone, zygomatic bone, palatine bone. It is triangular in shape, slopes downward and laterally, and it is the shortest orbital wall. Overlies maxillary sinus, and its landmarks are infraorbital groove and infraorbital foramen. All are responsible for the diplopia. And what about the roof or by now? This one more thing I would like to discuss is the floor. In floor is the that this is the shortest orbital wall of the orbit, and it is triangular in shape, slopes downward and laterally. And what are the landmarks of floor? That is the infraorbital groove and the infraorbital foramen. And these all are its applied chemistry is easily invaded by the tumors of the maxillary antrum, and diplopia is the main symptom of blow-up fracture. And lateral walls, have you understand lateral wall and roof and all these all are orbital margins also, and canals, margins, fossa, these all are the part of the orbits and its structures. What its clinical applications are: radiography, enlargement of the superior orbital fissure may accompany pathogenic processes. Pathogenic processes means, what are the pathogenic processes? Means related to any pathogen or pathology like aneurysms, meningioma, choroidoma, pituitary adenoma, or tumors of the orbital apex. And this all are the syndromes which you have read in previous lecture. And applied anatomy of Tennant's capsule you have read already, and the extraocular muscles are also included in this. Molar muscle, LPS muscle, and some included in orbit. So this all is about the orbit and its structure. These two lectures are previous one, and this one lecture is on orbit structure. This, by reading this or by understanding this, you will be understanding the value and the need and the importance of orbit, which is very important in our eye. So read it, listen my lecture, then read it from the book,